Hello and good morning. I think this has been a very stimulating set of presentations, and I know I certainly have enjoyed it. And the next presentation is one that I'm looking forward to because I think it brings together a lot of the questions that we've had, and a lot of where I think we need to go next, which was how do we even talk about this, and how do we frame these issues in a way that we can begin to move minds and move ultimately policy. And to do that, we have Julie Sweetland. Julie Sweetland is a sociolinguist and vice president for strategy and innovation at the Frameworks Institute. I've used their materials in my classes on this very issue of framing policy issues. I think I'm really looking forward to hearing what she has to say. She leads efforts there to diffuse the organization's cutting-edge, evidence-based reframing recommendations throughout the nonprofit sector. And thank you. I don't know where she is.
I'm right here.
I'm sorry.
Okay.
I thought you abandoned me.
Oh, no, never, never. Thank you. Thank you for that introduction, and I couldn't agree more that the comments that I'm going to share today I feel like are really extending, amplifying, and digging into some of the really important themes that the speakers previously have introduced, so I'm very happy to have the chance to be here. I'm going to talk about disrupting dominant thinking. At Frameworks, we're a nonprofit think tank. We investigate the communications aspects of social issues, have a multidisciplinary staff, PhD level researchers. I happen to be a linguist. We have political scientists, anthropologists, sociologists, and so on and so forth on staff. And the investigations we do take as a fundamental assumption that the frames matter, that people's understandings are frame dependent, that choosing what to say, what to leave unsaid, what to emphasize, how you do those things has a large impact on the way people hear, interpret, and act upon the different policies, proposals that are put forth on equity, racial equity and health outcomes, or any other issue. So an example of the different sorts of issues that I'll pull on research from projects like this today, we've investigated the communications aspects of criminal justice reform, which, as you know, is a real driver and reflector of health inequities in the nation, human services, environmental health, climate change, child mental health, systems of care, social determinants of health, as well as other issues, immigration, education, so on and so forth. And one thing that we do in the course of these investigations is to go out on the streets and ask people. We're the crazy people that say, hey, for $10 Starbucks card, will you talk to us on camera for 10 minutes? And we just ask people's top of mind assumptions. We use more in-depth methods as well, but these videos are way more fun to watch than the 100-page transcripts from 40 different people. So this is a typical dominant way that Americans across the nation think about what are the conditions that affect our health.
I guess lifestyle, if they exercise, if they smoke, if they drink a lot, do drugs and stuff like that.
Lifestyle. I say smoking, drinking, not eating healthy.
I keep thinking of health as like what you eat and your weight.
You probably eat out too often. Smoking,
your diet,
drinking and stuff.
Some families might raise their kids on fast food.
Nutrition.
Exercise is important.
Too much fat, too much starch.
Food.
Bicycles and green culture.
Bike more, drive less.
Green ways to do things, I suppose.
You can see that there are, in the public mind, 3 determinants of health. Diet, exercise, and smoking. This tells me a couple of things. One is that the public is good learners. What has been the emphasis of public health communications for the last 20 years, right? 2 is that to get people to think about population level outcomes, causes, consequences, there is some careful framing work that needs to be done. Individualism is the foundational cultural model in America. We are the most hyper-individualistic nation ever known culture ever known to mankind. So you've got your work cut out for you in terms of getting people to appreciate a population health perspective. and as we can see this, the public simply does not understand. They don't have a way to grapple with the mechanisms that create, maintain, or reproduce racial inequity. It is a black box for Americans, and they fill in that black box. It doesn't just stay empty. When there's a cognitive hole, people fill things in. So when we read, they are typically individual level explanations. When we investigated education, we fill it in with bad parents. When we investigated the problems in the criminal justice system, people fill in rogue cops and crooked judges or lawbreakers. That's what they also fill in with immigration. When it comes to health, they fill in people making poor decisions around their own health, not eating right, not exercising, smoking, and avoiding green behavior. When we introduce race into that particular individualistic understanding, what also comes with it? Over many investigations, we've seen Americans appeal to a model of historical progress as represented in this poster that kind of shows the fulfillment of King's dream in the election of an African-American president. But more broadly, there's a deep narrative that we solved racism in the 60s, that the policies that were structural were taken care of in the civil rights movement. And what does that leave us? If there are disparities, then how can we explain them? If it's not policy, if we've gotten over that, then it is the individuals or that culture. So it really can invigorate deficit thinking about communities of color rather than kind of shift perspective. I'll give you some strategies in a minute to think about how you can talk about disparities without that backfiring. And then a final model that the public uses to think about this is, which I believe the previous speaker Mindy emphasized quite eloquently, is this sense of separate fates thinking. That different populations, different groups, they lead separate lives, they have separate experiences, and the consequences for one are not shared consequences for all. On the topic of health, I'll show you just a little clip illustrating this kind of thinking in the public.
So it's their life. If they want to kill themselves slowly, then that's cool.
If it's their life, if they want to kill themselves slowly, then that's cool, right? So that's the kind of thinking around separate fates, that shared health problems don't affect us all. If the problem is in individuals, if we've taken care of racism and it's something that only lives in the hearts and minds of a few outlier, outdated individuals, but not in the ways that we're structuring our institutions, and you can't lead a horse to water, and the problems of other people are not my problems, this leads to a sense of fatalism around these issues. It is what it is. It can't be affected. The poor will always be with us. The apple doesn't fall far from the tree. Can't change our genes, and people are going to do what they're going to do. So this is what we are up against when we start to talk about health equity issues. It's daunting, but can't be left around because models matter. The models that the public reasons from, the opinions that they bring forth, shape our policy climate. To the question before of how to get this on the public agenda for policymakers and in ongoing campaigns, a key piece of that is get it on into the public's agenda, right? Into the hearts, minds, mouths of ordinary citizens, because that is who those elected officials are listening to and where they're taking their cues from what to prioritize. So it's not that people don't care about health, and it's not that we don't care about our fellow man or that sort of thing. We'll talk about that, but rather that the cultural models that we have available to understand health individualism, and the cultural models that we have to understand race, separate fates, and historical progress don't allow the public to really engage in the appropriate kinds of policy thinking. So the individualistic models, for instance, in climate change, and the lack of a causal understanding lead people to assert, over tens of thousands of people we've interviewed on this, that recycling is the solution. Same sorts of things kind of go through with health. People believe that better information is the solution so that individuals can make better decisions for themselves. However, that can be changed through our communications. And I'm going to give you a few things to do. One thing is some things to stop doing in talking about these. There's a tacit formula that guides, I think, a lot of the communication. See if you recognize this outline. You start with your social analysis, for instance, you know, that there's an inequity. Add some kind of salience cues, a whole scary statistics, you know, louder personal stories, and then think that this will shame the public into an epiphany. That doesn't work. It simply does not work with what we know about human cognition. Let me show you an example. This is a social media tile that was put out in connection with a TV show special on sugar that Jamie Oliver was doing in the UK. 26,000 primary age kids were admitted to the hospital last year because of tooth decay caused by sugar. By the salience measure, this is a pretty successful communication. We had 712 people retweet this. We had 377 people like it. And that salience and that is seen as a measure of communications working. Until you look at the responses, what is the kind of thinking? You've got their attention. What is the cognition doing? Here's the first tweet that appeared after that, pinned for all of those, 1,000 people to see. And neglectful parents forgot that part. The kinds of conversations that followed: educate, cook homemade food, drink water, take responsibility for your child's health. So again, information is the only solution for better personal decisions. We can't get sugar out of diets. What are we supposed to do? So fatalism. I refuse to give my son drinks which contain sweeteners in them. So individual responsibility. I did my part. Check. I've done my bit for that social problem. We can help with the toothbrushing. Consumerist responses. Well done, but good luck. I've worked in special dental care services, and the lines are 1,000,000 miles long. So the one person came to a systemic sort of understanding and ended up with fatalism, right? System is broken beyond repair. And then don't hide vegetables in children's meals, and children should be happy to munch a carrot, at which point I felt instantly guilty for giving my 4-year-old daughter spinach smoothies and pumpkin pancakes every morning. But then I thought, what does Love Lassie know? So the point is that simply telling people the scope of a problem, if you haven't shifted their cognition, if you haven't given them a framework in which to interpret these data, they can backfire and only invigorate sorts of things. When it comes around to race, this is a study that we did in that investigation of criminal justice. We gave groups a statistic like this and asked in group settings and asked people to think aloud about why is this? And you can see that we have talked about drug use being roughly equal, and so how can we explain these disparities? We've done a similar experiment with educational achievement gap data disaggregated by race and education, got very similar results, but let's listen in.
35 out of every 100,000, that might be like possession charges, but the other ones might be hard drug-related crimes.
And maybe that's what their parents were like. Maybe their parents were in prison or.
Now, the use is the same, but maybe the drug-related crime is more to do with like selling or possession, like a way to make money, to make up for their non-education and the unemployment.
Or just stealing because they want money for their drug habit.
Yeah, maybe there's African Americans or like repeat offenders or something. Maybe that, I don't know. Maybe that plays into it.
I think the African Americans have low self-esteem.
What was that last thing you said?
African Americans have low self-esteem too, which obviously explains disproportionate impacts in drug sentencing. So the point here is statistics that to you as a public health expert scream, this is obviously a systemic problem. These numbers cannot be explained. These rates cannot be explained any other way. It does not scream that to the American public. They will rationalize them away in lots of different ways without some very powerful cues for how to interpret them. So if you don't provide the meaning, they will provide the meaning. If you are not reframing, you're accepting the pre-frame that's coming with it, and you have a sense of what that is. So, how can we shift this? How can we change the narrative, as some people were talking about? We want to avoid stories that simply say who is affected and how much, and start to fill in stories that are more explanatory. I'll give some examples of this, but what affects what to what end? So more of a how, less of a how much. We want to avoid any story that leaves people able to just kind of say this is a problem only for those people, the vulnerable, whoever that may be. And instead, this is a problem with a system that should be contributing to our functioning society. So that whole city, whole society point of view that Mindy was talking about earlier. These data speak for themselves. Look how bad this is. That's not particularly helpful. Rather, here are the moving parts of this problem and use the data as evidence that there's a monkey wrench in the works somehow, that there's problems to deal with. This is a moral outrage. Moralizing is less helpful than tapping into people's willingness to get into problems. Americans will endorse and fall in love with solutions to problems that they will refuse to admit exist. It is a very, it's true. Go to the drugstore if you don't believe me, and just look on the shelves. But the sense that we love solutions, we love gadgets, we love tinkering, and we consider ourselves problem solvers. So moralizing is trying to, like, the first step is admitting we have a problem. We find from a framing point of view, the first problem is affirming that we have solutions available, and that's usually a more productive kind of way to engage people in the conversation. The system is broken and sweeping, and changes are needed now. That is a social analysis, and it is very accurate. From your communications analysis is often something quite different, and a more effective kind of frame is that improvements are necessary. There is a problem. We have to say there's a problem, otherwise why do we need to engage in solving it? But it's calibrating the level of problemness with the availability of solutions, right? And kind of keeping those there. So when if you go, it's this big, then the crisis thinking, and people are likely to shut down and assume the problem is too big to fix. So improvements are needed, but they're possible and they will have shared benefits. So some practical strategies for making that big shift. One is leading with a value that counteracts the sense of separate fates thinking. That may not mean, it often means not leading with a value prime of equity. I prefer to think of equity as the outcome of our communications, what we're trying to get to, the mindsets that we're trying to get people to endorse, as opposed to the input, the cue that I'm putting in front of them as to why this matters. Equity is a cherished ideal of ours, but it means different things to different people, as Natalie talked about this morning. So we want to tap into cherished ideals that we can see are helpful on these particular issues because they have very powerful priming effects. So ideas such as human potential, that we all have potential that needs to be available to our communities, pragmatism, which I'll show you some results on, that practical sense, can-do kind of spirit, those kinds of values. I'll show you this experiment here. Across the bottom axis, we've got here different values that we put in front of people on criminal justice reform. Fairness, that this is about making sure everyone has a fair shot. Prevention, let's getting to problems early. Cost efficiency, and pragmatism. This shows us the movement that people showed against a control group, on how endorsing, how supportive they were of progressive reforms in juvenile justice, racial disparities, and causes of crime. You can see that fairness, none of these were statistically significant. So it's putting fairness in as your values cue at the beginning is the same as saying nothing. Prevention worked on causes of crime, but was not helpful on other aspects of the issue. Cost efficiency made people want to really get to the causes of crime, but in terms of disparities, it actually moved people in a much more punitive direction. People would pay any amount to lock up those bad guys, right? But a cue of pragmatism, that we can take a common sense, step-by-step, methodical kind of approach to solving the problems before us, move people on these issues in the right direction. So how could you incorporate those into your communications? One very simple kind of example, if you've got titles of slides, a graph, a report you're kind of putting out, is your title the latest data on early health indicators, or is it maximizing potential? How are we doing? That's a values cue and using that kind of thing. Is it child poverty and homelessness, or infant mortality on the rise? Or are these challenges that call us to work harder and smarter? That's a cue for pragmatism. So we have studies available that recommend specific values for specific issues. All of our research is available open access on our website. We would encourage you to take a look at that, but just an example of how to tap into some of those shared fate, common good kinds of values. Strategy number 2 is to summarize less and explain more. Across several different studies, we've seen that explanation beats description. The difference is, are you simply presenting the determinant and the outcome next to each other? Are you listing the associations? Or are you getting into the causal mechanism? Are you specifying the process by which the outcome is happening? So here's an example of that. This is a pretty typical description on the left-hand side here of the social determinants of health perspective. That the health of Americans is not just medical treatments, but the conditions in which they experience. This is the social determinants of health, shaped by wealth distribution, employment, working conditions, quality education, food, housing, other factors. Health and illness follows the social gradient. Lower the socioeconomic position, the lower the health. Here's a very slightly changed, but that is what frame effects are, is that seemingly small differences in what you emphasize, how you choose to say it, lead to large differences in how people understand and the kind of narrative you are lifting up. So our physical, social, and economic environment shape our health. This is an assertion that is very different than what people are expecting, what they're bringing in mind when you start to talk about health. For example, when communities have areas with safe parks and sidewalks, exercise is easier. If we've got grocery stores, we can make the connection to diet, social support connected to mental health, poverty connected to access to food and housing, stress, unemployment leads to stress, leads to mental health. So what affects what and to what end? So that kind of explanation can lead people to be up to twice as supportive of kind of public-minded, progressive kinds of policies than the other ones. So third, Q, our third strategy, Q structural systemic interpretations 18 different ways before you put in disparity data. 18 is a number I just made up. But you need lots of very strong, you need to really push that kind of interpretation very proactively. People will fill in deficit understandings if you do not. So naked numbers are going to invariably be interpreted through unproductive dominant models like health individualism. Then if you're saying more of population X, Y, or Z is having this problem, then that's saying that more of them are making bad choices, not taking care of their health, not integrating into society, whatever that kind of sort of thing is. So order really matters. Use the data, and I'll show why. It's not to hide the data, but really you have to prime very strongly the understanding, meaning first and then numbers, to give the public a chance to come along with you. I'll show you an example of that. When you use values, when you use disparities data together, it's actually one of the most powerful ways of making the case. This is again from our research on criminal justice. We've seen something similar on health issues in the UK. We've tested 3 types of message: just facts on disproportionate impact on people of color in the criminal justice system, just the value, so pragmatism, we need to take a common sense, and then we combine those two, pragmatism and then the data. And you can see that just the facts is the same as saying nothing. Pragmatism, it gets you something, but when you can use that value, give people a way to understand we have a problem, we have a thing that we can do here together, we have a shared kind of common goal here, and the data reveal a threat to that value, then that was the most powerful way of making the case on this issue. I'm going to show you an example of applying that finding to a communication. So this is this is communications from oral health advocates. Blacks, Latinos, and Mexican Americans experience nearly twice the amount of untreated tooth decay as their white non-Latino counterparts. Stark racial inequities that characterize almost every area of life. They face very different opportunities based on skin color, language proficiency, country of origin, etc. Our research suggests that this kind of messaging, which I like to call the disparities data drop, is going to it's going to elicit a particular understanding of fairness that is available in American culture, which is you made your own bed and now you lay in it. You're in it. That poor outcomes are the result of poor choices, and that trends by race, as I've talked about, reveal cultural deficits, not structural deficits. So I'm going to skip past that. Here's what you can do instead. Reframe with fairness across places, which is the flavor of fairness that people have to go structural. They have to really start to think about asset mapping, access, availability of resources. So the zip code kind of argument has zip code way of talking about equity and inequities is the way we found to be the most reliable across several different issue areas. So same sort of message. When public health officials realize that some communities, that's a geography cue, were experiencing up to twice as much untreated tooth decay than others, they looked for underlying reasons and for the patterns of this chronic disease. It was more common in neighborhoods where, now I'm giving you more of a mechanism, right? Not just listing it's associated with employment and education. Neighborhoods where employment opportunities were few and access to healthcare and oral healthcare was spotty. This advocacy center took a practical approach to building community awareness of the troubling data among Blacks, Latinos, and Mexican Americans. So not hiding the race, but rather making sure there are some strong cues for this being about access and structures before we bring race into the conversation. We're engaging a young team of young men of color to serve as oral health ambassadors by bringing this issue to light and pointing out ways to get involved with groups waiting for change. This common sense approach to a campaign has started an uncommon conversation. So fairness across places, flavor of fairness, it cues our contextual sense. It gets people to think more structural. It brings in our sense, which is available to us, that circumstances beyond individuals' control should be taken into account. And the frame effects of pragmatism is to reduce fatalism, a sense that things, that it is what it is, but rather that we can take matters into our own hands, roll up our sleeves, apply some American can do. So I just want to close with a thought from Daniel Kahneman, who was a luminary in the thinking about framing. Our preferences are about framed problems, and our moral intuitions are about descriptions, not substance. So although we see in our research with the public some very deeply ingrained, well-rehearsed narratives that make it difficult to move a health equity agenda, we also see across our research that those preferences are not fixed, they are frame dependent, that the way we talk about these social issues can open up the barn raiser tradition, the collective tradition in American culture, and it is really up to us to shift our communications in order to advance that kind of agenda. Thank you. What are we doing? Oh, no, I'm all for standing. Okay, great. All right.
Well, I want to thank you for that. I just wanted to add that I'm a big fan of the Framework Institute's work and really appreciate this. Is just a taste of what you'll find on their website, and I would recommend you, if you're interested in learning more, to go to the website and look at the materials they have. It's really very interesting stuff. I did want to ask you a question.
Yeah, please.
So you didn't really get much into, it wasn't really where you were going with this, but I'd like to hear you talk a little bit about the use of words.
Yeah.
So specifically words like racism, sexism. How do people respond to those words? What effect does it have? How effective is it when you are making your explanation for how social determinants impacts health?
Sure. So in general, I think the name for something is a little less important than the explanation you attach to it. And so I thought that I really appreciated Natalie's discussion this morning of oppression and privilege as a way to get into concepts like sexism and racism. So I think that was good use. We just had a study, good advice. We just had a study that we just completed on implicit bias and how to talk about that. And if you really truly explain that people are exposed to media images over time, that we see certain kinds of stories, again and again and again, this builds up our understanding of how certain groups act and shapes our decision making. With that full explanation, the American public, and these studies is a pretty large experiment, really they buy it. But if you just kind of use the word implicit bias, people, it's not that helpful, right? It doesn't mean anything. So it's really more about the explanation you attach rather than the word itself.
Okay, I'll throw it open and see if anyone has any follow-ups to that question or any other questions. Jeff.
So this is a great presentation, and I guess a couple of months ago, the pragmatic stream as being so dominant in Americans' thinking might have been the one that I would have bought. But I wonder if you could comment on, we see an incredible divide, and it's on the left and on the right, in the presidential campaign, of people really wanting to think of big solutions to big problems as opposed to taking that pragmatic approach. And there's a tremendous divide, and I'm wondering whether any of that is showing up in some of your more recent research.
So I think there's a stable set of shared values. There's 3 dozen of them or so, right? It depends on how you slice it, but there's a stable set. Pragmatism is one that is in American culture, our belief in human potential, our belief in fairness across places, all these sorts of, they're all in there. The question is, which one are you going to pull forth? We all believe these things are good. No one argues against being practical, right? No one also argues against being effective. The question is, which one of these values can you know before you go, and really works well for that particular issue. So it may be the case that pragmatism is not the most effective value on some of the issues that are being discussed. It's also the case that lots of values are used in competing ways in the political discourse you're probably observing. So those folks are looking at which ones work for their issues too. In terms of and pragmatism is a core piece of American culture. It's not going away. I guess it's just the question of whether or not you can harness it for a particular communications goal. Does that get to your question? Does that?
Well, it doesn't. It doesn't. Okay. But because, there is a suggestion in the pragmatic approach that you can't unify the country, or you create almost a movement, if you will, around a very, very big picture kind of change. And there's at least a strain in American politics right now that is suggesting that people can be motivated by that bigger vision.
Well, let me give you an example from that. So we found in our work on K-12 education that a message about transformation, we want to blow up the system and start over again, right? A message about transformation freaked people out, right? They dismiss it as too idealistic to work, or they are scared of it and don't want people experimenting on my kids, right? So, however, you can get people to endorse very transformative policies using the metaphor of remodeling. Our education system is like a valuable old house that needs to be maintained and updated. We want to take a careful look at what works, what doesn't, and update it to meet today's needs. That kind of metaphor, people say, okay, well, yeah, I can do that. And they will endorse pretty radical policies such as detethering property taxes from education funding, which is kind of the root of educational inequities in lots of ways. So the difference between what you're putting in as a cue and what you're getting out, I think, is what you're getting at. Is getting at. So I think we can get people to transformation. Talking transformation may or may not be the way to get there in health.
If I could just follow.
In the campaign.
If I could follow up with a more specific
Yeah.
question,
Yeah.
I think what Jeff is trying to get at.
Yeah.
So if you look at Bernie Sanders' message, which is, let's blow the place up and start over again, and you juxtapose that with the Republican message of let's repeal and replace Obamacare, right? It doesn't seem to be that their message, the Republican message of let's make change in a more practical way of voting to repeal Obamacare is really getting traction. But on the other hand, Bernie Sanders' message is getting a lot of traction, and his message is let's blow it up.
Talk to me in December.
What's going to happen in December?
Well, there will have been an election by then.
But last week. The polls already indicate, and what happened in Iowa already indicates that his message has traction.
Has traction.
Wait till December.
All right. So Frameworks is a nonpartisan organization that does not work on political campaigns. We work on long-term evolution of social issues.
Great answer.
So
next question.
Thank you. Great answer. Next question.
I'm just curious. So we have been discussing and using very liberally the phrase American culture.
I am, aren't I?
Not just
yes.
you. I mean, we
purposefully so. Yeah.
And Americans in the U.S. Depends on where you stand, what American culture is, and where Americans stand, right?
Yeah.
So my question is, based on your data, depending on, assuming that they are representative samples, large enough sample sizes in your experiments, these recommendations, do they work uniformly across all population groups, or the effects could be differential across different population groups?
That's an excellent question. Thank you for raising that. In order to fit some big ideas into a short space, I cut some corners on the way we think about some of these issues, so I'm glad you raised that. We intentionally work, because we are working to allow a sector, a field of advocacy practice, to have some shared resources that they can use in messaging. We intentionally try to work at a very broad and high level. We look for what is shared among groups that are normally thought of as having very different opinions. So are there differences between, in the thinking between conservatives and liberals, between African Americans and whites, English speakers and non-English speakers? Yes, absolutely. I'm not trying to say there aren't differences, but our work is designed specifically to see what you can expect to be stable across those groups, even though you might not expect it to be. So that's one thing. One limitation of the data is this work, all the things I've talked about today, not necessarily all the work we ever do, but this work is conducted with native speakers of English, and so that does exclude quite a broad swath of the American public. When we are doing the large scale surveys, so for instance the quantitative data I showed you, that's a nationally representative sample of the voting public. So again, that there is that excludes some folks, but we think it's the most reliable way to kind of do this. And when we are doing the analysis, we are looking for things that work across the broadest swath. So for instance, we know race, class, gender, political affiliation, region, education status, socioeconomic status, whether or not they have children, sometimes something else that's relevant, like do you live near an ocean if we're doing climate change. So we know a lot about these folks, and we're looking for what works across groups. If California is driving it and it's not working, in the South, then that's not a recommendation we want to come out with, because it's not helpful to a full sector, of advocacy practice. By virtue of working on social change issues here, we don't have the luxury of the micro-targeting, and that I'm going to come up with a message that works with left-handed Lithuanians in Lancaster, and then another one that works with right-handed Republicans in Rochester. Like, we're not in that world, and so we think that a kind of some shared high-level messages is the best thing that we can offer.
Next.
So I just want to go back to that Kahneman quote, because I've been sort of puzzling over it a bit. I was taking that to say that you don't change people's preferences on the basis of substantive issues, but rather by how you describe them. And is that what you mean? Because that's actually sort of disconcerting to me.
So there is no such thing as an unframed communication, is I think the main thing I'd want to say. So whatever substance you are talking about, you are framing it. You are privileging one interpretation or another by every choice you make in the presentation of that substance. So frame effects are not everything. Right? There is substance, there are predispositions, as the previous question was curious about, but there is this untapped or underutilized source of power that we have as change agents, which is intentional framing, conscious framing, looking at data when framing. So no, I don't mean to suggest that substance is irrelevant, and I certainly don't mean to suggest that we dissimulate or obfuscate or spin. Our own work is about science translation. It's about inviting the public into expert modeling through the use of good communications and helping them become more informed decision makers, advocates, and citizens. So substance absolutely matters, but you are framing your substance for good or for ill, and so.
But it is a little chilly, is it not, that moral intuitions are about description rather than about substance? I mean, I just think about it, it makes me feel a little unhappy.
It's provocative, which is why I put it up there, and I invite you to wrestle with it, continue. But I think there's more truth to it than we are willing to admit. We are often framing our own, we are often directly communicating, explicitly restating our own moral intuitions. The ticket that brought us to the dance may not get the public in. Right? And so across social issues, I probably work with 40 different advocacy groups in a given year. The equity conversation is the conversation. The equity conversation is what motivates the work of many of folks who are in sessions like this. Leading with that kind of message may not be the way to bring in the most people for this kind of movement, but they absolutely can get there. They will support equity. It's a matter of the invitation that they get.
Okay, we have time for one more question, and we'll take.
Okay, this is a question from the web. I'm not sure that you can entirely answer this.
Is it from Love Lassie?
No.
Okay.
Okay. It's not.
Okay.
It's not. That would be funny. In my experience, even systems that understand how selected structures negatively impact health are reluctant, if not resistant, to changing the health education message away from individual health behavior to structural barriers. How might we hold health systems more accountable for promoting the message of the social determinants?
Oh man, I wish I knew. It's difficult. So I think the observation is well-founded. For instance, we were working with the Centers for Disease Control on their messaging around the human health impacts of climate change. And there were multiple perspectives, but there at the end, when it kind of came around to what can we do, the instinct was, make sure you can get to a place that's air conditioned when it's hot. And we're like, no, can we talk about the availability of cooling centers in cities, right? And so the instinct was to set up this broad thing, mechanisms, population level impacts, and the solutions that come around are individual. And the public has learned that in our work on environmental health. People could get that air and water affected human health. But the policy level, how that happens through policy was really hard for people to see. They filled in that environmental degradation was just kind of the price we paid for modernity, so oh well, and what you should do is buy a Brita filter, right? And so, air filters Brita and make sure you exercise. And that was really the solution. So I don't think I'm the right person to ask how to hold the public health sector responsible for telling the public health story, even all the way to the end, which is the solutions we can take. But if you guys could work on that, it would make my work a lot easier. So that would be awesome.
Thank you very much, Sylvia. And on that note, we'll break now for lunch for 30 minutes.